It doesn't matter. They have this multi-payer system, which is very fucking stupid. It's heavily regulated multi-payer system. I think the French have something very similar. But multi-payer, single payer, you don't need to know the difference. Basically, you allow different formations, but they're heavily regulated and guaranteed. So you get the health insurance. You could just pick from different payers.
But like their model is something that perhaps the United States could at least borrow from some elements of it. And that's just like, I mean, that's a significant drop off. Everyone else is.
How do you counter the argument that many people would lose their middle manager health jobs if you had Medicare for all? Did you guys cry when Pittsburgh lost 500,000 jobs because of the steel mills moving to Japan and China? Did you give a fuck? See, the difference between those guys is they actually made something of value. They made something of value for our society. You're telling me I'm supposed to care about worthless, paper-pushing parasites? Find another job! If anything, you're telling me that means I'm definitely cutting red tape. I'm taking care of a bureaucracy. Thought you guys hated bureaucracy. Wait, suddenly you love bureaucracy? You love make work? You love bullshit jobs? So some middle manager dipshit could stand around and deny your mother cancer care by some bullshit lying interpretation of your confusing policy? That's what you want to protect. Somebody said a lot of them could admin for nationalized healthcare. Actually, no, they wouldn't because they're not needed. Medicare has the lowest overhead of any health insurance plan. I think it's like 2%. The average private health insurer is around 15 to 20%. So, yes, some of them would just lose their jobs because the government would be more efficient. I think we should protect them the same way we protected the horse buggy whip industry or when the steel mills closed in Pittsburgh. None of you gave a shit when people who were making real stuff for the economy lost their job. Now I'm supposed to cry tears for the the health insurance parasites? I hope they go bankrupt. Just like all the millions of families who went bankrupt because they couldn't afford to pay for the health care they needed. Now, here's the problem. Here's the problem, chat. Is that I have to compromise, which is very frustrating. I have to compromise because Bernie Sanders doesn't agree with me. AOC doesn't agree with me. AOC and Bernie Sanders say Mike is wrong, which sucks. You know what they say? They say in the Green New Deal and our Medicare for All program, we have a 52-week salary guarantee for all the employees of health insurance companies, and we offer them retraining assistance so that they can find another job. Boo fucking who? So I say fuck them. But unfortunately, Bernie Sanders and AOC, they think, won't somebody think of the health insurance parasites? And they have an extremely generous benefit to help them land on their feet in another worthless paper pushing bullshit job. The only way health insurance companies make money is by raising premiums, deductibles, /OOP, and most importantly, denying coverage. The letter I got today from Medical Emergency opened with, in these days of rising healthcare costs, it's important that the balances for healthcare services be paid in a timely manner. And it went on to say it will go to collection agency if I don't pay today. Wow, thanks for starting out the letter so sentimentally. Tell them to eat shit and die. Now, you know,